Hey guys, Dr. Shelly here. I want to talk to you about urinary tract infections and yeast infections and why it seems that there are so many people that can't get out of the vicious cycle of UTIs, then a yeast infection, then another UTI, and then another yeast infection. Many people are in that cycle for years, like the majority of their life. This is a big deal. For anybody who's watching this who's never had a UTI or a yeast infection, they are miserable, like miserable. There are reasons why this happens. I want to explain that to you. And I'm going to also share with you some natural remedies that are super effective. UTIs are urinary tract infections. Usually it's a bacterial infection that's affecting the lower urinary tract. And UTIs account for 9 million office visits per year in our country. UTIs can be brutal. What happens is there's bacterial overgrowth in the urinary tract. And what happens when you go to a medical doctor and you go the medical route is that you're prescribed an antibiotic. And antibiotics are very effective at handling a urinary tract infection. However, the antibiotics are also partially responsible for developing a yeast infection, which I will get into in a minute. Antibiotics are the most common treatment for a UTI, and it works by killing the bacteria, right? So then the UTI goes away. So what do you do, or what can you do naturally once you get a UTI? There is a supplement, a whole food supplement from Standard Process. It's called Arginex. And Arginex is kind of like a kidney detoxer. And because it's a whole food supplement, it means that it's from food. So it's completely natural. And I have used this personally. I've gotten a UTI and I've used this and it works. It's amazing. The other thing that many people know about is cranberry juice. Cranberry juice has something in it. Actually, blueberries do as well. But cranberries have something in it that actually helps your body detach the bacteria on the urinary wall. And therefore, when you go to the bathroom, it passes the bacteria all the way through. How many of you have heard, oh, you have a UTI, drink cranberry juice? There is a huge problem with that because almost all cranberry juice has a ton of sugar in it. And when you consume a lot of sugar and you have a UTI, you are making the problem massively worse. The more sugar you consume, the longer your UTI is going to stick around. So because most cranberry juice has sugar in it, the benefits from the cranberries, you're not getting them. What you need to do is get 100% cranberry juice, which is not tasty in my opinion. It's very tart. It's not too enjoyable to drink, but that will help. That will do the trick. So get a bottle of unsweetened cranberry juice or eat a ton of cranberries or blueberries, and that will help in addition to the Arginex. The other things that you can do to help prevent a UTI and actually help the UTI that you might have heal faster is if you are having sex, you have to go to the bathroom immediately after. So you have sex, you're like, hey, hold on, I'll be right back. Go pee and come back. Because when you're having sex, there are bacteria that's actually in the vaginal canal that's not supposed to be in the urinary tract, that because of everything that's going on down there, the bacteria is actually moving from where it's supposed to be to where it's not supposed to be. The other thing that you need to do besides going to the bathroom immediately after intercourse is when you go to the bathroom number 2, meaning a bowel movement, and you go to wipe, you do not wipe from the back to the front. This is a good rule to follow all of the time, even if you're not going to the bathroom number 2. You always want to wipe from the front to the back because there is bacteria in the bowel movement and in your anus that's not supposed to be in the front lady parts. So always wipe from the front to the back. Those are all the things that you can do to help to prevent UTIs and to reverse the ones that you might already have. But what happens if you went and you got a prescription for an antibiotic, your UTI went away, and then a week later you have a yeast infection? So yeast infections, they're different than UTIs. Anybody who's had a UTI or a yeast infection, you know how different they can be. They're similar in the sense that there is an imbalance of good bacteria in your urinary tract or in your vaginal canal. And yeast infections can happen anywhere in your body. You can have a candida overgrowth in your mouth, on your skin, which can cause acne, can cause bad breath. However, candida naturally lives in the vaginal canal. And what happens when you take an antibiotic, you're killing off the good bacteria that keeps the candida, in check. So there's no overgrowth of it. So although the antibiotic kills the bacteria, so you don't have a UTI, it actually kills the bacteria that's keeping the candida at bay. So once that good bacteria is killed off, the candida, which is opportunistic, is like, oh my gosh, we're going to take over right now. Because that's what a fungus does. Now you have itchiness, discomfort. Sometimes it's painful. You're squirming in your chair. Yeast infections down there are no fun. What many people do is they go to the store and they get something like Monistat, which is, like a suppository, and it kills off some of that fungus, some of that candida, right? So the symptoms seem to go away. But you never really fix the problem of repopulating that good bacteria down there. And so what happens is you are now prone to getting a yeast infection again or another UTI, especially if you never changed anything, like if you didn't start wiping from front to back, or if you didn't start going to the bathroom immediately following sex. A lot of people have learned to just live with this for 10, 20 years, like every other month they're dealing with one of these things. I've experienced both, and it could be miserable. What you can do if you have a yeast infection, and actually you can do this to prevent yeast infections, and you especially want to do this if you've recently taken an antibiotic. You want to take a probiotic. You want to take a really good probiotic. So spend a little extra money and get one that is really good. The other thing you can do is you can find some boric acid. And you want to find boric acid that's a suppository. They usually come in like little, capsules, and there's powder in it. And you take one of the capsules and use it as a suppository, put it in your vaginal canal right before you go to bed, and it will dissolve. This is so effective at handling yeast infections. In fact, personally, I think it's more effective than Monistat and prescription antifungals. And it's a really good idea if you're somebody who's prone to yeast infections to use boric acid suppositories, like maybe use it like once or twice a week, just on a regular basis. There's not really any side effects that I know of, at least. It's pretty inexpensive. It's easy to use. You just put a little capsule up your vaginal canal right before you go to bed, and it can help to prevent yeast infections. It actually helps to balance the pH of your vagina, which also helps to prevent yeast infections, because yeast is opportunistic. It needs to be the right environment. So there needs to be no bacteria keeping it in check, and there needs to be a perfect pH for it to basically take over. So the probiotic and the boric acid are incredible. And again, I would do that on a regular basis if you're someone who's really prone to yeast infections. The other thing that you need to do to help to prevent yeast infections is don't wear a wet bathing suit longer than you have to. It actually creates the perfect environment for yeast to kind of take over down there. The other things that you want to avoid are, you want to avoid scented tampons and any other personal hygiene products that, have, they're fragrant, they have a fragrance. Really bad idea. It messes up that pH down there. You also want to avoid using like flavored or scented lube or condoms, because it messes up that perfect pH balance in the vaginal canal, and it actually destroys some of the good bacteria living down there. That's a lot of information. I get it. But, for those of you who have dealt with either of these things, and that cycle that just keeps happening, UTI, yeast infection, UTI, yeast infection, it's like miserable. It's enough to drive someone crazy. Go back, listen to this, and just try to implement all of those things. You're going to be able to get out of that UTI, yeast infection cycle. It might take more than a couple days for you to see results, but long term, you really shouldn't be getting either one of those. It should be a very, very rare thing if you do. I hope this information was helpful for you guys. Please share this with anybody that you know who is suffering with UTIs or yeast infections, because it's miserable, and you could be helping them by sharing this video with them. Thanks so much for watching, guys, and I will see you in the next video.